I will go through the normal structures in the CT scan of the brain, and this is a CT scan of the brain axial sections starting from the lowermost cut. And what you are seeing here is the zygomatic arch on either side. That is the nasal cavity, it's part of the maxilla. And what you see here is the C1 or the atlas, and this is the dens, and this is the spinal cord, and this is the external ear. One cut above, and we see essentially the same structures, and here you can start seeing the eyeballs, and again it is the same here, one cut above, and this is the foramen magnum through which the medulla oblongata continues down as the spinal cord. This is the external auditory canal where you can see air appearing black. In the nasopharynx, air appearing black. In CT scan, air. Inside the orbit you see the fat. Fat also appears black. Fat, air, and as we will see later, the cerebrospinal fluid, water, will also appear black. So here you see the external auditory canal, ear, foramen magnum. This is the occipital bone. Next you are start seeing the intracranial cavities. This is the cerebellum, cerebellar hemisphere. This is the vermis, and here you start seeing the temporal lobes. That's the orbit, eye. This is the nasal cavity, and one above essentially the same. Now you see this is the medulla, and this is the cerebellar hemisphere, and you start seeing the brainstem. That's the temporal bone. This is the petrous part of the temporal bone. This is the petrous part of the temporal bone, and these are the mastoid air cells. As I said, air appears black, and you see this is the internal auditory canal through which 7th and 8th nerve pass. They go to the middle inner ear here, and you start seeing the optic nerve here. That's the nasal cavity, and that is the frontal air sinus. One above you start seeing the orbital roof, and this is the sella turcica, or the sella where the pituitary gland is situated. So this is the petrous part of the temporal bone. This is the occipital bone, cerebellar hemisphere, temporal lobe, and you start seeing the frontal lobe here, frontal air sinus. Again here, frontal lobe, temporal lobe, cerebellum, that's the brainstem. This is part of the pons. What's here you seeing the fourth ventricle where the CSF appears black here, and here you see these black spaces. These are all CSF filled basal cisterns. So it's the frontal lobe, in temporal lobe, cerebellar hemisphere, that's the brainstem. That is a basilar artery, the white thing. This is the petrous part of the temporal bone. Again, frontal lobe, temporal lobe, cerebellar hemisphere, pons. These are called the supracerebellar cisterns, where you see the CSF spaces. You can see it's all black. So in CT scan, CSF, air in the frontal sinus, in the mastoid sinus, and the fat in the orbit, they all appear black. Air, water, and fat. Now here is a place where the circle of Willis is situated. You can see the middle cerebral artery here, middle cerebral artery here. That's the basilar artery, and that is the posterior cerebral artery going down. This is the fourth ventricle. This is pons, temporal lobe, frontal lobe, cerebellar hemisphere. One above essentially the same. Just these are the Sylvian fissure, or the lateral sulcus, which separates this temporal lobe from the frontal lobe, and that is a parietal lobe. So frontal, parietal, and this is temporal, or separated by this Sylvian fissure. You see this is the midbrain lower part, where you can see the small cavity. This is the aqueduct of Sylvius. Cerebellum, you are still seeing some part of the cerebellum. So this is frontal lobe, this is temporal lobe. As long as you are seeing the Sylvian fissure, it's still the temporal lobe. So you see here, this is brainstem. This is the crus cerebri of the midbrain, and you can see here is these two projections are part of the corpora quadrigemina, or the colliculi. This must be the inferior colliculi, and this is the third ventricle. Third ventricle is slit-like. So earlier we have seen the fourth ventricle here. This is the third ventricle, cilian fissure, frontal lobe, temporal lobe. These are the frontal horns, part of the frontal horns of the lateral ventricle. That's the third ventricle. This is midbrain, and you can see the cistern around the midbrain. Now this is the frontal lobe, still you are seeing temporal lobe, and this is the occipital lobe. The posterior most is the occipital lobe. The frontal bone, temporal bone, this is the parietal, and this will be the occipital bone. So here still you are seeing the same thing, and this cut is very important. This is where you see the frontal horns, and you see all these sulci on either side, and this V shape, you can see a little bit hypodense. You can see here, that is a internal capsule. This V shape area is the internal capsule, common place for the stroke and common place for the bleed to occur. That is basal ganglia, caudate nucleus, basal ganglia, and these are the thalamus. On lateral to the third ventricle lies the thalamus. And this is the body of the lateral ventricle, and this is the choroid plexus inside this structure which secretes CSF. And you can see some calcification in the choroid plexus. White structures, calcification, bone, and the fresh blood, they appear white in the CT scan. So you see the frontal lobe, parietal lobe, this is occipital lobe. So frontal, parietal, and occipital. This is the body of the lateral ventricle. As you go up, parietal lobe disappears. This is mostly frontal lobe, and the occipital lobe also disappears. So this is frontal and parietal lobes. So you can see all these nice sulci filled with the CSF spaces.